During the procedure, we give you a lot of numbing medicine inside the penis and at the nerves that innervate the penis as well. We'll also give you some pain medicine, both in the IV after the procedure, as well as some oral pain medicine to go home with to decrease your pain. After the procedure, you'll wake up with a jock strap or an athletic supporter. That will have a lot of gauze in it and give you some compression to decrease the swelling. I also leave a drain or a little tube that takes out some of the fluid for 1 day after surgery, and that reduces the swelling a lot. What you can be doing is using ice packs and continue to wear that jock strap after the procedure. That will help a lot with pain and with swelling. Your incision site will have stitches or sutures that will fall out on their own. You'll also have a skin glue on top of that area. There's nothing special that you have to do, just keep the area clean. You could shower the day after the procedure, but don't fully soak the wound in a bath, a hot tub, or a swimming pool. One to 2 weeks after the procedure, when the swelling is starting to go down, we want you to start pulling down the pump and also feeling where the pump is, just to get a sense of where it is and how to feel it. Some of the pain medicines that we give you can cause constipation, so you'll go home on stool softeners to help improve that. In addition, we do want you up and walking around pretty much the same day of the surgery to decrease any chance of blood clots or anything like that. After your procedure, I don't want you doing any sort of heavy lifting for about 2 weeks. I don't want you bathing or getting in a hot tub or a swimming pool. You can certainly take a shower the day after the procedure. And obviously, until the whole implant is fully healed, we don't want you having sex or masturbating. Your ability to drive again after the procedure will depend on how much pain medicine you're needing. Most guys within 1 to 2 weeks are back driving again and not needing narcotic pain medicine anymore. As far as work, similarly, it'll depend on what you do for work. For patients who work at a desk without much physical lifting, about a week is fine to go back to work. If you're doing specifically physical activities, about 2 weeks or so. But of course, every patient is a little different. The full recovery period for you to actually be able to use the device and have sex again is about 6 weeks. That being said, you will be up walking either the same day or the morning after the procedure. Specific things that we want to know about after the procedure: if you see any sort of drainage, specifically something that looks like pus coming out of the wound, we want you to let us know. That being said, if you're ever concerned about your wound or how things are going or how you're healing up, please call us. We're always happy to see you. Everyone in our office knows that if anyone calls with any sort of concern, we get you in either the same day or within a day or two to be evaluated. After the procedure, I like to see patients in about 2 weeks afterwards in the office. I like to check on you myself, take a look at the wound, see how you're healing and how you're feeling, and then talk to you about instructions on how to sort of get a feel for the pump. Most patients will take about 6 weeks to fully heal and be able to use the device and have sex again. We want you to sort of see us, be evaluated before you go ahead and try anything on your own to make sure everything is healing up appropriately. If you have any sort of questions, comments, or concerns during your recovery, I do want you to reach out directly to my office. Everyone in my office knows that if anyone calls in with a concern, and we'll get them in pretty much the same day to be evaluated, so I can see you myself and take a look at how you're healing up and make sure we address any sort of concerns.